Representatives of the Government of Thailand, representatives of the Government of the United States of America, representatives of the Colombo Plan, the other co-sponsors of this meeting, the African Union, Organization of American States, representatives of any people here with substance use disorders, and people working in prevention and treatment of substance use disorders. It is my pleasure, on behalf of the World Health Organization, to join the organisers in welcoming you all to this combined meetings of the 16th Thailand National Conference on Drugs and the inaugural meeting and workshop of the International Network of Substance Abuse Prevention and Treatment Professionals. Indeed, the title of the conference, from Her Royal Highness, to succeed in getting all people get happiness and free from drugs, is very much in keeping with the constitution of the World Health Organization. And since its inception, the World Health Organization has always sought to improve the health and well-being of people everywhere, in part by reducing the exposure to risk factors for health, such as drug use, and through trying to improve the health and well-being of people suffering from health conditions, such as drug use disorders, in particular through the healthcare system, and where necessary, through fostering collaboration between the healthcare system and other systems, and to think of a whole of, to think about the healthcare consequences of decisions that are made in other sectors. The use of addictive psychoactive substances, including tobacco, alcohol, psychotropic medication, illicit drugs, and new and as yet unscheduled psychoactive substances, is one of the biggest risks to health in the current era. Combined, they represent 10% of the global burden of disease and are responsible for millions of deaths each year. While to some degree, substance use has been a traditional part of many cultures, the eras of industrialization and globalization have led to significant increases in the production and consumption in many regions of the world, a process which is still continuing as many emerging markets open up to both licit and illicit products. With tobacco and alcohol, it is now clear that regulating these markets can significantly reduce the harm due to substance use, as the Framework Convention on Tobacco Control, the first treaty negotiated under the auspices of the World Health Organization, and the Global Alcohol Strategy highlight. But in addition, a comprehensive approach to preventing harmful alcohol and tobacco use also involves addressing the risk factors which predispose to substance use and those factors which protect from substance use, such as we've heard, the kind of employment programs, alternative development, education, family, meaningful employment, a supportive family environment, and so on. While the strategies for responding to illicit drugs are necessarily different when it comes to regulating the drug market, the approach for managing the risk and protective factors are essentially the same. In the last year, an estimated 1 billion people are smoking, several hundred million have alcohol use disorders, and at least 16 million are thought to be problem drug users, with several hundred million people using drugs, the majority of whom want to reduce or cease their use. For a time, healthcare systems around the world were slow to respond to this challenge. As we've heard Gilberto mention, substance use disorders were often not recognized, and people who used substances were often treated with social exclusion rather than people who needed help, assistance. As Her Royal Highness, the Princess Mother here, said today in the video, that drug abusers are also human, and we have to help them to a better life. Many people who develop substance use disorders do so, in fact, in response to very difficult life circumstances. And we see extremely high rates of physical, sexual, or emotional abuse and many coexisting mental and physical health problems. Incredibly, many people are able to change their patterns of substance use on their own or with the support of family and friends. However, it's clear that the treatment of substance use disorders and coexisting physical and mental health problems significantly improves the chances of reducing or ceasing substance use, as well as well-being and life expectancy. In supporting healthcare systems around the World Health Organization seeks to define which are the key elements required to respond effectively to different healthcare problems, so that effective healthcare may be available to as many people as possible. In its most recent estimates, WHO estimated that less than 10% of people with substance use disorders around the world have been able to get the treatment they need. This new network of substance use prevention and treatment professionals has the potential to change that by increasing the number of professional staff and by fostering networks of learning between and within countries. On behalf of WHO, please allow me to join the organisers and co-sponsors of this meeting in welcoming you to this inaugural ISSUP meeting and workshop. I hope we can work together to improve access to quality treatment and prevention services to those in need. Thank you.